Okay, before entering the patient's room, I went ahead and checked her chart, make sure there was orders in there. Went to a supply room, gathered my supplies. I have a couple of trumpets, some syringes, sterile syringes, and some sterile suction trays. Also, I went ahead and grabbed a suction kit to set up on the wall because I don't believe that it's set up in there. So I'll go ahead and enter the room. Knock, knock. Hi, Mrs. Smith. My name is Kate. I'm from respiratory. Today it looks like that the doctor ordered some suctioning, some nasal suctioning that we're going to go ahead and do, okay? If you don't mind, I'm just going to go ahead and listen to your breath sounds and see how you're doing. Wash my hands. You go ahead and take a nice cough for me. Oh yeah, you can hear that you have a lot of mucus there. We're going to help suction some of that out for you, okay? Clear up that airway. Listen to your lungs. I'll monitor her SpO2. It's rather low, so we'll go ahead and see what we need. I'm going to set up the suction canister on the wall, set the pressure to in between -120 to -150 for an adult here, and we'll start her off at -120. And now I have these different size nasal trumpets. Mrs. Smith, one of the this nasal trumpet needs to go into your right nostril here, so we're going to go ahead and insert. I just want to make sure I have the correct size. This one you can see is way too big for her, so we won't use that one. And this one right here goes right to the ear tip, right to the nair, so it looks like it will be a perfect fit for her. So we have that. We have her sterile kit. My oxygen is hooked up, so we can hyperoxygenate her. Suction is hooked up, and we'll go ahead and get started. So I'm going to open up my sterile suction catheter tray here. Open it up. Upon opening it, you'll see that there's two gloves. It is a sterile procedure, so I'll go ahead and put on the first glove. My left hand is going to be my clean hand, and then my right hand is going to be my sterile hand. And I'll go ahead and put some lube on my sterile hand. Okay, Mrs. Smith, go ahead and take a deep breath for me. Make sure that the nasal trumpet is nice and lubricated. You always want to make sure that the bevel is facing the septum. And if you have any resistance going in, then we can always try the other side. It might have a deviate, or the patient might have a deviated septum. And so, Mrs. Smith, go ahead and take a deep breath in. 1, 2, and 3. And we try to insert with a nice smooth motion, not too forceful, but quickly, because it is rather uncomfortable for the patient. Okay, Mrs. Smith, I'm just going to give you some oxygen here, okay? Keeping my sterile hand sterile, my clean hand clean. I'll go ahead and grab the sterile catheter and put some saline into the sterile tray here. Okay, lift up my catheter to the wall, test to make sure that it is suctioning, and it is. Go ahead and run my hand through to make sure that it is nice and lubricated. Okay, Mrs. Smith, now we're going to go ahead and insert and suction out some of that mucus that's giving you a hard time here, okay? So on the count of 3, I'll have you take a deep breath in, and I'm going to insert. We want to make sure we do this quickly, taking no longer than 15 seconds. Feel some resistance, pull back a little bit and include the thumb hole and pull out. Okay, Mrs. Smith, great. We'll go ahead and give me a cough. Sounds a lot better. We'll give you some oxygen here. I would monitor her oxygen levels, making sure that the patient tolerated the procedure. And it looks like it's still a little bit low, so we're going to give Mrs. Smith a little bit of time here to recover. Mrs. Smith, we're going to go ahead and leave that nasal trumpet in because we are going to need to suction you again a little bit later today, and I don't want to have to keep on inserting it in and out because it's going to cause some trauma to the inner lining of your nose there, okay? So make sure that the patient is as comfortable as can be, low locked position of the bed. She has her call light if she needs anything. I'll go ahead and clean up, put away all my stuff, and come back and revisit the patient